Hi, welcome to my YouTube channel Hope Fertile. From today we are going to start topic wise video series. Our first topic is female reproductive system.
Fertility related topics are mainly concerned with the main basic subject, that is female reproductive system. So we are going to start this anatomy, embryology and all we will cover in this video. Please, if you find any mistakes, you can comment in the comment section, and this is entirely exclusively for the educational purpose. Hope you enjoy. Let's start. So our topic, female reproductive system. We'll start with the embryology of reproductive system. With the start of embryology, I like to start with each zygote inherits 23 chromosomes from mother and 23 from father. So producing 23 pairs of homologous chromosomes, 22 of these are autosomal chromosomes and one pair, that is 23rd pair, is sex chromosome. In this, XX is in females and XY in males. Y is believed to be derived from X, so it will be sequences are similar to X. So in early embryonic, gonads can become testes or ovaries. So Y chromosome induces formation of testes, and testosterone from the testes induces the formation of male sex organs. And in the absence of testosterone, female sex organs are formed. So, formation of testes and ovaries. In first 40 days after conception, gonads of males and females are very similar. Then, cells that will give rise to sperms and eggs will migrate from yolk sac to developing gonads. Then, these gonads have potential to become testes or ovaries until testis determining factor causes conversion to testis. So, testis determining factor is produced by sex determining region of Y gene. So, para-mesonephric ducts, which give rise to the female reproductive system. So, we will see the development in females of para-mesonephric duct. So, in female, the para-mesonephric duct persists and undergo further development. The portions which lie in the genital cord fuse to form the uterus and vagina. This fusion of the para-mesonephric ducts begins in the 3rd month, and septum formed by their fused medial walls disappears from below upwards. The parts outside this cord remain separate and each forms the corresponding fallopian tube. The ostium of the fallopian tube remains from the anterior extremity of the original tubular invagination from the abdominal cavity. About the 5th month, a ring-like constriction marks the position of the cervix of the uterus, and after the 6th month, the walls of the uterus begin to thicken. So, for a time, the vagina is represented by a solid rod of epithelial cells. A ring-like outer growth of this epithelium occurs at the lower end of the uterus and marks the future vaginal fornix. At about the 5th or 6th month, the lumen of the vagina is produced by the breaking down of the central cells of the epithelium. The hymen represents the remains of the sinus tubercle. So, if you see the derivatives of para-mesonephric Mullerian duct, in males, it is forming the appendix of the testis in uppermost part and prostatic utricle in the lowermost part. So, in the females, the uppermost part is becoming the appendix of the fallopian tube, and upper vertical and middle horizontal part is forming the proper fallopian tube. Then, lower vertical part, it forms uterovaginal canal after fusion with opposite side. Then, upper part, it is forming the uterus, and the lower part it is forming the upper part of vagina. So let's start with the anatomy of the female reproductive system. So first, if we see the pelvic floor, so all tissues lying between the pelvic cavity and the surface of the vulva and perineum. It includes pelvic peritoneum, extraperitoneal fat and cellular tissue, and levator ani and their facial coats, the triangular ligament that is urogenital diaphragm, the perineal muscles and their aponeurosis, and subcutaneous fascia and fat, and then skin. When we see pelvic diaphragm, the levator ani muscles plus the fascia which covers their upper and lower surfaces. In the midline, the pelvic floor is pierced by urethra, vagina and rectum. So if we see levator ani muscle, it has three parts, and it is the ischio-coccygeus part, which is having the origin from the ischial spine, inserted into the front of coccyx. The ilio-coccygeus origin from white line on the lateral wall of pelvis. It is inserted into the tip of coccyx and raphe. The pubo-coccygeus part, its origin from the back of the pubic ramus, inserted into tip of the coccyx and raphe. So if we see the pubo-coccygeus part, it sends fibers to the urethra and vagina and rectum to blend with their intrinsic muscle described as pubo-urethralis, pubo-vaginalis, pubo-rectalis. Now we come to then labia majora. It has outer two skin folds raised by underlying fat and passing back from the mons veneris to the perineum. The outer skin is covered by hairs, while the inner medial surface is smooth, hairless, and contains sebaceous and sweat glands. Labia minora. Two thin folds of modified skin situated medial to the labia majora. Then the hymen, a membrane situated about 2 centimeters from the vestibule that demarcates the external from the internal genital organs and closes the vaginal orifice. Bartholin glands, these are the greater vestibular glands. Bilateral compound racemose glands, they secrete mucus during sexual excitement. Situated deep in the labia majora at the junction of the posterior and the middle thirds. Its duct is 2 centimeters long and opens between the hymen and labium minus. Then the vulva. It has also vestibule, the area between the inner aspects of labia minora and the fourchette. Structures that open in the vestibule are urethra and Bartholin glands, and vagina. Vestibular bulbs, these are the long masses of erectile tissue that lie on each side of the vaginal introitus. So, external urethral meatus, it is a triangular slit in the anterior part of the vestibule below the clitoris in which the urethra opens. Then scinis duct, two blindly ending paraurethral tubules which open in the floor of the urethra few millimeters from the external urethral meatus. Then vulval blood supply, it can be the arterial supply of internal pudendal artery, the terminal branch of the anterior division of internal iliac artery that ends as a dorsal artery of the clitoris. Branches from the femoral artery supply the anterior part, superficial and deep external pudendal arteries. Then venous drainage, it will form venous plexus from which veins accompany their corresponding arteries. The veins draining the clitoris join vaginal and vesical venous plexus. Then lymphatic drainage and nerve supply fissure. Lymphatic drainage from skin and appendages to the superficial inguinal lymph nodes to the deep inguinal and femoral lymph nodes, of which the lymph node of the cloaca drains the clitoris directly. From the former superficial group, lymphatic channels pass to the deep pelvic nodes, including the external iliac, common iliac, then para-aortic lymph nodes. Nerve supply of the vulva. The vulva is supplied mainly from the pudendal nerve, that is S2, S3, and S4. Additional sensory nerves are supplied from the ilioinguinal nerve, that is L1, the genital branch of genitofemoral nerve, that is L1, L2, and the posterior cutaneous nerve of thigh. Now comes to vagina. It's a fibromuscular tube from the vulva to the uterus, forming an angle of 60 degrees with the horizontal plane. Length: anterior wall is 8 to 9 centimeters, posterior wall is 10 to 11 centimeters. Vaginal fornices: the cervix projects in the upper blind end of the vagina that forms a pouch, vaginal pouch, around the cervix, and is divided into 4 fornices, 2 lateral, anterior, and posterior, that is deeper fornices. Anatomical regions of vagina. So anterior 1/3, it is in the upper 1/3, it is trigone of urinary bladder. Then lower 2/3, it is urethra. Posteriorly, upper 1/3, peritoneum of Douglas pouch. Middle 1/3, ampulla of rectum. Lower 1/3, the perineal body. Laterally, lower end, it is related with bulbocavernous muscle, vestibular bulb, and Purpurtholin gland. 1 centimeter above orifice, urogenital diaphragm. 2.5 centimeters above the orifice, levator ani muscle with the pelvic fascia above it. The lateral fornix gives attachment to the lower part of the cardinal ligaments. The ureters pass through the cardinal ligaments 1 centimeter lateral to the vagina. When we see the vaginal supports, ligaments attached to the upper vagina are pubocervical ligament anteriorly, McEnroth's ligament laterally, uterosacral ligament posteriorly, levator ani muscles pubovaginalis part, and triangular ligament and the perineal membrane. Vaginal fascia, that is connective tissue fascia, that condenses anteriorly forming the vesico-vaginal fascia and posteriorly forming the recto-vaginal fascia. So if we see the histology of vagina, the cut section of the vagina is head-shaped. Okay, head-shaped, and with approximation of the anterior to the posterior walls, it is formed of 3 layers: mucosa, musculosa, adventitia. Mucosa, it's formed of squamous epithelium without glands. Musculosa, which is fibromuscular with some fibers from the levator ani inserted into it, and adventitia, which is connective tissue continuous with the paracarpus. Blood supply. So anterior supply, the vaginal artery from internal iliac artery. Additional branches from middle rectal artery from internal iliac artery itself, and inferior rectal artery from the internal pudendal artery of the internal iliac artery. So venous drainage, plexus around the vagina, the vaginal plexus, drain into the internal iliac vein by veins that accompany their corresponding arteries. So lymphatic drainage and nerve supply physics. Lymphatic drainage of the vagina. Its lower 1/3 drains into the inguinal lymph nodes. Upper 1/3 follows lymphatic drainage of the cervix. Middle 1/3 drains in both upper and lower directions. Nerve supply of the vagina. The pudendal nerves give sensory fibers to the lower vagina. So now comes the major part, that is uterus. Uterus, a pear-shaped hollow muscular organ. It's measuring around 7.5 into 4 into 2.5 centimeters in the longitudinal, transverse, and anterior-posterior diameters. It is slightly larger in multipara than in nullipara. So if you see the supports of uterus, upper are round ligament and broad ligament, and middle are transverse ligament, pubocervical and uterosacral ligaments. Lower are urogenital diaphragm, levatorine, and perineal body. So uterine and cervical ligaments that are broad ligament, round ligament, and Ovarian ligament. Broad ligament, it is a double sheet of peritoneum that extends from the lateral wall of the uterus to the lateral pelvic wall. Its outer upper part forms the infundibulopelvic ligament in which the ovarian vessels traverse their way to the ovary. So this is the broad ligament. So if we see the contents of the broad ligament, round ligament, ovarian vessels, uterine vessels, ureter, parametrial, lymphatics and lymph nodes, sympathetic and parasympathetic nerves, parametrial, pelvic cellular tissue and fascia, embryological remnants to the Fallopian ducts, hydatid cyst of Morgagni, Coblett's tubules, epiphyron, paraepiphyron, Gardner's duct. Then when come to round ligament, here it is the round ligament. Okay, it is a fibromuscular ligament attached to the uterine cornu. Okay, uterine cornu. So runs downwards and forwards in between the two leaves of the broad ligament to enter the inguinal via the internal inguinal ring and comes out of it at the external inguinal ring to be inserted in the upper part of the labium majus. It pulls the uterus forwards and helps keeping it in an anteverted position. So when it comes to the ovarian ligament, the fibromuscular ligament that attaches the inner lower pole of the ovary to the cornu of the uterus. It plays no role in pelvic support of the uterus. The cervical ligaments. These are condensed thickening of pelvic cellular tissue that lies between the pelvic peritoneum above and the levator ani below and radiates outwards from the cervix to reach the pelvic walls. They act as the chief support of the uterus and pelvic structures. 3 pairs of ligaments are there which are very main to study about. We'll go ahead with it. Mac and rod ligament, uterosacral ligaments, and pubocervical ligaments. Mac and rod ligaments, these are cardinal ligaments of the cervix, spread out on either side from the lateral cervix of the lateral surface of the cervix and vagina. They are fan-shaped manner and are inserted in the lateral pelvic wall. And uterosacral ligaments, these are from the cervix and vagina backwards surrounding the rectum and below the uterosacral folds of peritoneum to become inserted in the third piece of the sacrum. Pubocervical ligaments, these extend from the anterior surface of cervix and vagina forwards beneath the bladder and surrounding the urethra to the posterior surface of pubis. Now, we will see the divisions of uterus. So, first is the corpus uteri, body that lies above the internal os. Okay, this is the histological internal os, and this is corpus. So, cornu, the area of insertion of the fallopian tube, and this is cornu, fundus about the insertion of the tubes. This is fundus. 3 structures are attached to the cornu, that are round ligament anteriorly, fallopian tube centrally, ovarian ligament posteriorly. Now, another is isthmus. This part is isthmus, an area 4 to 5 mm in length that lies between the anatomical internal os above and the histological internal os below. Okay, it is lined by low columnar epithelium and few glands. So this isthmus expands during pregnancy, forming the lower uterine segment 10 centimeters in length and during the last trimester. And in the cervix, which is the main thing to study of the cervix, it is the elongated lower part of the uterus, and it's measuring to 2.5 to 3 centimeters, divided by the vaginal attachment. So divided by the vaginal attachment into supravaginal portion above and vaginal portion, portio vaginalis below. The cervical canal is the cavity that communicates above with the uterine cavity at the internal os and below with the vagina at the external os. Okay, here it is connected with the uterine cavity, and here it is with vaginal cavity. The external os is round in nulliparous and slit shaped in multiparous. The cervical mucosa has two ridges, anterior and posterior, from which transverse ridges radiate to form the arbor vitae uterine. So cervix, as we have seen, that is the lower part of the uterus, and it is lined by smooth mucous membrane and connects uterus to vagina. So, however, during ovulation, this becomes thinner to allow sperm to easily pass into the uterine, the cervical mucus. Okay. So, the cervix has three main parts. Okay, endocervix and exocervix and the cervical canal. So, endocervix, this is the inner part of the cervix that leads to the uterus, and the cervical canal is links the uterus to the vagina. The exocervix, which is the outer part of the cervix that protrudes into the vagina. During childbirth, the cervix dilates, widens to allow the birth of the baby. So position. So position of the uterus. The uterus is kept in an anteverted, anteflexed position with the external os lying at the level of the ischial spines by the support of the cervical ligaments, endopelvic fascia, and pelvic floor muscles. Levators. Anteversion means the uterus is inclined anteriorly to the axis of the vagina. Anteflexion, it is the body of the uterus is bent forwards upon the cervix. Okay. So, relations of the body of the uterus. If we see, anteriorly the bladder and the vesico-uterine pouch, posteriorly the pouch of Douglas, laterally the broad ligament on each side. So, relations of the supravaginal cervix. Anteriorly it is urinary bladder, posteriorly forms the anterior wall of pouch of Douglas, laterally half an inch lateral to the internal os. The ureter is crossed by the uterine artery, that is ureter below the uterine artery. The uterosacral cardinal and pubocervical ligaments are attached to its posterior, lateral, and anterior surfaces, respectively. So, if we see the histology of uterus, there are three layers: endometrium, that is mucosa; myometrium, it is musculosa; and peritoneal covering or perimetrium. So, endometrium, it is lined by simple cubical or columnar epithelium, contains tubular glands, shows cyclical changes with the menstrual cycle under the influence of ovarian hormones. Okay. Myometrium, it is the outer longitudinal muscle layer is present, middle layer of interlacing crisscross muscle fibers surrounding the blood vessels, and inner circular muscle layer is present. So perimetrium, it is anteriorly firmly attached to the fundus and body till the isthmus, where it becomes loose and is reflected on the superior surface of the urinary bladder, forming the vesico-uterine pouch. Posteriorly, firmly attached to the fundus, body, cervix, and posterior vaginal fornix, then is reflected on the pelvic colon, forming the Douglas pouch. Laterally, the anterior and posterior peritoneal coverings blends as the anterior and posterior layers of the broad ligaments. Then, when come to histology of cervix, Endocervix, lined by simple columnar epithelium with compound racemose glands or crypts that are liable to chronic infection. It secretes alkaline cervical mucus. Muscle layer, outer longitudinal and inner circular muscles, 2 layers only. And ectocervix, it is having the form of stratified squamous epithelium covering the outer portion of the cervix. The junction between squamous and columnar epithelium at the external os is either abrupt or it may form an transitional zone 1 to 3 mm known as transformation zone. So, arterial supply. The uterine arteries arise from the anterior region of the internal iliac artery in the base of the broad ligament, crisscrossing above the ureter half an inch lateral to the supravaginal cervix. There are 2 branches, an ascending and descending branch. The ascending branches pass upwards in a tortuous manner, parallel to the lateral border of the uterus between the 2 layers of the broad ligament to end by anastomosing with the branches of the ovarian arteries near the uterine cornu. The descending cervical branch supplies the lower cervix. So, venous drainage starts as a plexus between the 2 layers of the broad ligament, pampaniform plexus, that communicate with the vesical plexus and drains into the uterine and ovarian veins. Lymphatic drainage, fundus will have its lymph nodes that are para-aortic lymph nodes via ovarian vessels. Cornu to the superficial inguinal lymph nodes via lymphatics of the round ligament. Body will have to the internal then external iliac lymph nodes via the uterine vessels. Isthmus, as the top of the cervix, cervix will have 2 groups of lymphatics. Will have paracervical, parametrial, obturator, internal and external iliac nodes. Secondary groups are common iliac, para-aortic and lateral sacral lymph nodes. Nerve supply of uterus. The cervix and the body are relatively insensitive to touch, cutting and burning. The cervix is sensitive to dilatation and the body is sensitive to distension. Innervations like parasympathetic form S2, S3, S4. Sympathetic from T5 and T6, that is motor, T10, T11, T12, L1 from the sensory. Both reach the uterus through branches of inferior hypogastric plexus. Now comes to fallopian tubes. These are 2 tortuous tubes, 10 centimeters length, lie in free upper part of the broad ligament. They blend medially with the cornu of the uterus. Laterally, their free outer end curves backwards towards the ovary. Their lumen communicates between the uterine and peritoneal cavities. There are 4 parts. First interstitial part, that is 1 centimeter, pierces the uterine wall, very narrow, no peritoneal covering, no outer longitudinal muscles. Isthmus, that is 2 centimeters, straight, narrow, thick-walled portion lateral to uterus. Ampulla, 5 centimeters, the widest tortuous, thin-walled outer part. Then infundibulum. This is 2 centimeters, trumpet-shaped outer end into the peritoneal cavity by the tubal ostium. The ostium is surrounded by fimbriae, one of which is long and directed towards the ovary, fimbriae ovarica. Tubal functions, as we know, there is an ovum pickup at the time of ovulation by their free fimbrial end, transport of the ova through the tubal lumen by the peristaltic and ciliary movements, and production of secretion necessary for capacitation of the sperm and nutrition of the ova during the journey by the lining cells. So, anatomical relations of these fallopian tubes: above by the loops of intestine, below by the broad ligament and its contents. Medially, they blend with the cornu of the uterus, while laterally they are bounded by the lateral pelvic wall. The ovaries lie posterior and inferior to the fallopian tubes at each side. So the histology of the fallopian tube, as it's having mucosa, that is endosalpinx, and arranged into 4 to 5 main longitudinal ridges that give rise to the subsidiary folds or plicae. It is lined by columnar, partially ciliated epithelium. Muscle layer, outer longitudinal and inner circular involuntary smooth muscles. It is thick at the isthmus and thin at the ampulla. Serosa, peritoneal covering. The extrauterine part is covered by peritoneum in the upper margin of the broad ligament. Blood supply and lymphatic drainage of the fallopian tubes. So arterial supply, if we see, branches from both uterine artery and ovarian artery. And venous drainage, right ovarian vein drains directly into the inferior vena cava. Left ovarian vein drains into the left renal vein. Lymphatic drainage, para-aortic lymph nodes directly via ovarian lymphatics. Nerve supply, sympathetic and parasympathetic fibers. Applied anatomy, if we see, that is tubal pain is referred to the tubal points on the lower abdominal wall, half an inch above the mid-inguinal points. So comes to the ovary. It's a almond-shaped organ and lying in the fossa ovarica on the lateral pelvic wall. It measures 3 into 2 into 1 centimeter, not covered by peritoneum. Surface is pearly white and corrugated by the effect or the monthly ovulatory activity. So it has 3 attachments: mesovarium, a peritoneal fold that suspends the ovary to the back of the broad ligament. The infundibulopelvic ligament suspends the upper pole of the ovary to the lateral pelvic wall and carries the ovarian vessels, nerves, and lymphatics. The ovarian ligament attaches the lower pole to the cornu of the uterus. Then anatomical relations of the ovary. The ovary is bounded medially by the fallopian tube, laterally by the lateral pelvic wall. Superiorly and anteriorly, it is surrounded by the small intestine. Inferiorly by the ovarian fossa, where the ureter and internal iliac vessels pass. So histology, if we see, it is subdivided into cortex, medulla, and hilum. So, see here, cortex, medulla, and hilum. So, medulla, the central core of the ovary, surrounded by the cortex and continuous with the hilum, it is formed of the connective tissue. So, then the cortex, the outer active part of the ovary that produces hormones and oocytes, formed of surface epithelium of cuboidal cells called the germinal epithelium, covering the free surface of the ovary. Then stroma, composed of the dense connective tissue containing the oocytes. It is condensed on the surface to form the tunica albuginea. So you're seeing the oocytes here in the cortex. So the hilum, it is the site of the attachment of the mesovarium that carries blood vessels, nerves, and lymphatics entering and leaving the ovary. Okay, then the blood supply and the lymphatic drainage. Arterial supply, it is ovarian artery which is arising from the aorta at the level of L2 and passes through the infundibulopelvic ligament. Ovarian branch from the uterine artery which anastomoses with the ovarian vessels at the broad ligament. Then venous drainage, the ovarian veins accompany the arterial supply and they shall join with the pampiniform plexus and the uterine vein. Lymphatic drainage to the para-aortic lymph nodes via the ovarian vessels. Then nerve supply, insensitive except to squeezing on parvaginal examination. So sympathetic and parasympathetic nerves T10 and T11 through the pre-aortic plexus that accompany the ovarian vessel. So we have covered mostly the anatomy part of female reproductive system. Hope you have learned some of the basic knowledge about the female reproductive system. So please comment in the section how did you feel about this video. Any suggestions are invited for surely. So as this is my first video series on the topic wise, so hope you enjoy this video. So if you like the video, please like, share and subscribe, and I shall let you know what my next topic soon. Thank you.